New Zealand's South Island has one of the fastest growing Pacific populations in the country. Communities there were only further strengthened when uniting against the spread of COVID-19. As a result, Pasifika had the fastest vaccination rates out of any other group. However, the impacts of the pandemic further exacerbated pre-existing issues like the cost of living, Pacific pay gap, education and housing issues. Alicia Foon spoke with Pacific community leaders in the South Island as they weighed in on the political debate, breaking down what people within their region need ahead of the election.
In the heart of Oamaru resides a thriving Pacific community, which makes up 20% of the 14,000 people that live there.
Here, our Tongan community are our largest Pacific ethnic group, followed by our Tuvaluan families, and we have an increasing Fijian community.
That's Hana Halalele, Waitaki District's first Pasifika Deputy Mayor.
Groceries are really expensive. We have increases with interest rates with our mortgages, and then that increases also the rental payments for a lot of families. Down here in the south as well, we have a lot of seasonal workers that are at our freezing works, and they're currently in off-season. Challenging time, especially during winter when you've got an increase in electricity bills. You have a house full of children to feed and you're out of work. And if you're on a work visa, then you're not eligible for any government support from work and income.
In Christchurch, University of Canterbury Director of Māori, Pacific and Rainbow Student Services, Ricky Welsh, says future governments need to prioritise more Pacific-based research and focus on mental health impacts of the Christchurch earthquakes.
Particular niche that has not been researched is Pacific people. So Pacific young people that have grown up during the time, earthquake generation, what are the issues going to be? And what is anyone doing about it? You don't see anything for the Canterbury-based issues in national politics at the moment.
He says overall the Ministry of Pacific Peoples under Labour has been fruitful.
I do worry about a government that may remove some of these agencies which have helped increase cultural identity. And I think the South Island would suffer worse than the North Island because simply for the fact there's so many less of us here.
In Dunedin, Reverend Alofalale says people need higher wages to survive.
Everything's going up, and wages are not meeting that. There's a big Pacific pay gap there that needs to be bridged and bring, people's wages up to parity with non-Pacific.
She says people have a lot to consider come this election.
As Pacific people, Labour has always been, a party that you will align yourself with. You feel that this is the party that looks after you, and the faith is still there for many people in terms of movement for the future. But there is also a lot of ifs and a lot of questions. And so I think people are lacking a bit of confidence.
Invercargill-based surgeon Dr. George Nye says he feels let down.
Like many of this government's policies, it doesn't translate into meaningful actions. Hopefully after the elections there would be a change, but again, realistically, this would depend on availability of funding for the health space. We are concerned that the government has a large debt.
He says unlike Auckland and Wellington, people living in rural South Island and small towns experience their own set of health challenges.
The main need is to access medical care, both having access to GPs, having access to hospital care. This is a widespread problem both in mainstream and ethnic communities, but it's more acute with more serious consequences in the Pasifika community.
Pacific community leaders will be visiting hotspots around the South Island in the coming weeks to provide civic education for eligible voters ahead of the 14 October poll.